Hi, and welcome to the Suli Show. My name is Ahmed Suleiman. I have two special guests with me today who are dedicated to mental health and the effects that it has on minority communities, especially the Toronto Somali community. I have Faisal Hassan with me, who is a member of Ontario Legislative Assembly. He is a strong critic of issues affecting low-income communities and frontline workers. He is also a strong advocate for youth engagement and a prominent leader of the Toronto Somali community. The MPP of York South Weston, Faisal Hassan. Also, I have with me Hodan Ahmed, who is the president of local CUPE 2137, also a researcher and a policy consultant. Hodan is a strong advocate of employment equity, diversity, and inclusion. Hodan and Faisal, welcome to the Ahmed Suli Show.
Thank you.
Thank you, Ahmed. Thank you for having me.
Yeah, thank you for having us.
Yes, Faisal, I would like to start with you. If you could tell the audience who lives in York Southwestern, the demographic of the people that live in the community.
Well, thank you, Ahmed, for having me again for your show and York South Weston. It is a northwestern part of Toronto, and it is a diverse community here, old community, immigrants, and also working class community and middle class communities. And it is also located in the south of the 401, and also the west is the Humber River, and the south is to the St. Clair Street, and to the east will be the CN rail tracks. And this community is diverse. You have the old community villages such as the village of Weston, which is one of the oldest settlements here, also part of the city of York, and also part of the North York, and also communities, diverse communities, backgrounds of all over the world, mosaic. You could come to York South Western. Basically, you could go any restaurants from diverse parts of the world, which is also the richness of our community.
You have a lot of frontline workers in your community who have been very busy this past year. What can you please tell us about them and their hard work?
Indeed, absolutely. We have the largest. Actually, we have a large frontline workers that are vital to moving food, groceries, and making things happen for not only York South Western but the entire province. And they are folks who are looking after in our seniors. They are also folks who are working in hospitals, in groceries, in factories, and they are really doing a work that is needed the most. Unfortunately, because of the pandemic, 60% of them they don't have paid sick days, and also when they get sick, they cannot stay home. They have to continue to work, and that also makes their lives difficult, because if they are sick, they should stay home, and but they don't have paid sick days, so they have to continue to work, and this is a shame, and it's also happening in this community. And also we have been advocating also the legislature to provide them pandemic paid. To this day, we are in second wave. We are now approaching the end of second wave, and some of them, I say the majority of them, have not even received pandemic paid. And as you know, many of them are BSWs who are working very hard. These are decent, hardworking members of our community, and they are not paid well. And as you know, that the exposure that the military has actually informed us about the long-term care homes. This also have been also a part of where they are basically sent as a part-time workers, where they work multiple places, and that is also contributing a very difficult and able to have a living wage. We want to also make sure that we raise their wage to $4 extra, and also provide them a pandemic paid right away, not just delay them.
Just quickly, if you don't mind going into what is the reason to why they haven't gotten that, or why it's
Well,
delayed?
that is the we have
Is
a
it just the
premier.
politics?
It is a dark food, a conservative government,
Right.
says one thing in the media and does another things, and that's why they are not putting these essential frontline workers front and center. It's not a priority for them. We have put several bills and motions. One of them I can highlight is to raise BSW salaries. Another one is paid sick days. If you are sick, stay home. And all these things are also pandemic paid. So what the priority of the government is basically to big corporations. We've witnessed that when small businesses are actually allowed to continue their work, but big box stores are allowed to continue, and you can't even practice social distancing there. I say, Ahmed, it is lack of a leadership, and definitely we need a better government, and we can do it better.
Hodan, I'm sure you also have a lot of frontline workers, and as a president of local CUPE, what could you tell us about your experience in this past year with COVID and the people that you support?
So in terms of the work that I do, we are in the employment sector. So it's Employment Ontario, and the company or the organization which is unionized that I represent, the 175 staff in the organization that I represent who are unionized, are all of us predominantly with the exception of psychologists who have to go to work in Monday to Friday on and off on a bi-weekly basis. All of us are working from home. So actually, the organization that I work with have really taken that on board seriously. But what I can speak to in terms of COVID-19 is that for my more, I would say my volunteer, my community engagement, I was the chair, the co-chair of the Confronting Anti-Black Racism Unit, the PAC, which is a body that has been appointed by the City of Toronto to be the partnership and accountability circle, basically accountable and to the Black community and facilitating almost like a stewardship for the Black community to have access to the City of Toronto in a way to dismantle the gatekeeping that takes place in many of these institutions, especially at the government level. And so what we did, my colleagues or my fellow PAC members, for the 2 years that we were there, which ended as of March of this year, is that we organized the first meeting between the mayor, the deputy mayor, and Black thought leaders from the healthcare sectors, such as Tayibu, Black Health Alliance, as well as food security, what we call food sovereignty specifically. And so Food Share, for example, and Paul Taylor, and as well as other leaders, the Black Legal Clinic, Ruth, and who was the executive director at the time. So we brought a lot of these different leaders to have a meeting, and that was April of 2019, at the height of COVID-19, really. And so I co-moderated that with Emmanuel Mellers. So NAPSI, he's the lead of NAPSI, and probably Ahmed knows him. And so what we did is that we wanted to actually have one-on-one conversation with the mayor, with city funders, city leaders, and to take Black issues, specifically the impact of COVID on the Black community. So anti-Black racism and the socioeconomic impact of that is not new to us. It's just that when you are already disproportionately impacted by anti-Blackness within the system, and having a pandemic creates even more of a disproportional impact in the Black community, and predominantly a large segment of our Black community are frontline workers, whether they are in the food, cleaning industry, manufacturing industry, as well as the healthcare industry, long-term carers, Black PSW workers, and nurse as well, frontline workers in the actual medical hospitals and clinics. And so what we wanted is to really have institutional presence and leadership presence in the City of Toronto, decision maker. The City of Toronto ultimately has an $11 billion budget that they sit on. And so having actually Black health leaders, people from legal sectors, food sovereignty, people who really dramatically has a more of a grassroots impact in the Black community, the diversity that is the Black communities, to really have a voice. So they were part of the decision-making process. So that has been one of the really successful things that we've done. and just partnering also and working in alliance with the unit, because the unit is a government department. But we as non-government employees wanted to facilitate that relationship and have a direct conversation with city leaders as well as employees, and have brainstorming sessions in different ways. And so that would be, I guess, more of a direct way that we've engaged with the City of Toronto, with the municipal government in particular, and to address anti-Black racism from a different perspective, whether it's around policing, around COVID-19, and what does that look like, especially the fact that the Provincial Emergency Act gave a lot of power, unsupervised and unaccountable power, to the police, where they can stop anyone whom they deem that they don't belong here, they shouldn't be here. And we know that historically, disproportional people who would be racially profiled and impacted by this would be the Black community. It's particularly Black men and young Black youth. And so we wanted to have that kind of a conversation so the municipal government can advocate, while at the same time trying to connect with the provincial government on those issues, with which they have failed to really respond. But the municipal government has been really more agile, more willing. A good example is the Toronto Public Health agreed to do the race-based data collections, and which that gave an actual numbers of who in the community in the city of Toronto has been impacted the most. And for obviously we had the numbers. We know that the Black community are impacted the most, but we needed to see those data, to these kind of a disaggregate race-based data from scientific and quantitative and qualitative data.
Do you think the Somali community is affected the mostly in terms of when it comes to these anti-Black racism issues?
I don't know if it's the most. Definitely the Somali community. We are,
or one of the highest.
I think because we are at the intersection,
Right.
at the intersection of Muslim identity, Islamophobia, as well as anti-Black racism. And so we're dwelling. So when you're racially profiled as a Somali, you're not just racially profiled because of your Blackness, but you're also racially profiled because of your Muslim identity, or what is supposed to be your Muslim identity, because to be a Somali is extremely synonymous with being a Muslim, whether you identify as such or not, right? Majority of us are Muslim and identify as Muslim. And so when it comes to the impact of COVID, I think the conversation, we don't have the actual numbers or actual evidence, but we know by actually looking at neighboring countries or other Western countries like Sweden or England, where a majority of the early death of COVID-19 were really predominantly brown and Black, and a lot of Somali people were experiencing COVID and many of them died. But when it comes to in Canada, we really don't have the number, and maybe Ahmed might speak to, Faisal might speak to that, but it's really something in which that I don't think even Black Health Alliance and other health bodies are looking at the ethno diversity within Blackness, because sometimes in Canada, Somali people's Blackness is denied. People say that Somali people or certain segment of our elders do not necessarily identify with being Black, because their cultural, or what we call from a social science perspective, their social identity is tied more into their tribe, into their regional identity, right? And so, but a lot of time when it comes to conversation around anti-Black racism or Blackness, East Africans tend to be kicked to the curb and really not acknowledged by the larger Black Caribbean. And there's also an element of Islamophobia that plays into that conversation. And so I think having those kind of a nuanced conversations among the Black communities as a collective would be really very helpful, because I don't think the stats that are going to be collected specifically by Black Health Alliances will actually have a breakdown. I would like to talk to them and say, is there a breakdown of people of East Africans, right? People of West African, continental Africans, what are the impact of COVID-19? What are the social determinants of health of the Somali community, of the Ethiopian community, of the Ghanaian community? Because there's a large presence of a lot of different communities from continental Africa.
Yeah, I know the stigma is high in terms of the Somali community and understanding COVID. And I remember early on when it started, we were, I know, even especially my parents, they weren't taking it as seriously. So we could, in terms of culturally and when challenges such as COVID hits us, how do you think the Somali community handles it? And do you think we could do things better? Faisal.
Well, I mean, first I would like to talk a bit about the mental health you mentioned.
Yeah.
I have sponsored Bill 178, with my colleague from Bucktail High Park, Botila Koprochi. And that bill is an act to proclaim Black Mental Health Day and to raise awareness of related issues. And also by proclaiming first Monday in March in each year as a Black Mental Health Day. And also go further, creating awareness, but also a collection of data. And if this bill passes, then it will create first Monday of in March in every year that will be able to celebrate and create people to come forward and to talk about the issues, and we can tackle the issue of stigma and so forth, and also put resources to that. And we have to have a culturally appropriate programs and services to then support in that regard. Not only that, but also we want to create an entire ministry, not just a junior ministry such as this current government, but a ministry that has the resources. So you're right, it's key to get these data, and this data is very important. And the Black community is also a diverse community. That's very important. And to also acknowledge that and also have that culturally appropriate services to cater that differences also is very important. With regard to the awareness of the, I think folks, until they see it, this is serious, people are dying, they won't take it seriously. And this is not only, and this is also every health related issues in the past. Now the community is getting it. They're getting it because we have lost a lot of members of our community. Right here in my own community of York South Weston, we have lost elders, we've lost young people, and this is also hitting every community. So that evidence is really happening. And also when we are bearing or in funeral issues, we can't even visit them because or participate to prayer with them at the mosque because we are not allowed in large gatherings. There was a couple of cases I wanted to go, I couldn't. So another, people see that the mosques is not accessible to them because they see that. So people are now confined at home, and also it creates also mental issues, and that also needed support systems in place. And that's why we wanted to ask this government to provide that kind of investments in mental health, and also for not people being also punished in terms of if they lose their jobs, if they lose an income, what happens to them? They will lose their mortgage, they will lose their homes. And what about, a lot of evictions is happening. So we need to prevent that in the middle of this and to help. Yes, I think you're right. Education is required. Maybe we can do better. The Toronto Public Health and the also Ministry of Health could create more informations on in languages to provide more awareness of this, such as the radios, the televisions, and also the newspapers, so people could also, or even social media, like your radio, for example. You have a large audience following you, and that's also a way to provide some advertisements. But this government is not advertising a community papers or community media. They're just advertising big corporations, the resources of the government. And that's another issue and priority. So this is another way we can also inform the public by these channels, by also translating those health issues as well, and also sharing those material to the community at large, where they come, their spaces, and so forth. And also people cannot do this for free. They should be supported in that regard, and government should be there to support them. So I think you're right. Awareness is not only asking people to acknowledge what's happening, but it's also the responsibility of the government to provide those informations and in more detail so that people understand, and different also methods that could reach to them through social media, through radios, through television, through newspapers, and so forth, even websites.
Faisal, and if we can connect to the issue of eviction, COVID, and the mental health, I've heard disturbing news that there were 12 families that had been living on 2419 Keel Street,
Right.
and they received the N13 notice within
Yeah.
days of the building being purchased by a landlord. So if you can, and that something like that has a severe mental health effects on someone, especially someone with a family. Uh, if you can quickly speak on that issue.
Yes, absolutely. Thank you, Ahmed, for reminding us. This is a breaking news. This happened last night, and these are smaller size buildings that are when you come off the 401 on Weston Kill, sorry, Kill on 401 to the south. You could see smaller high-rising buildings, and there are 12 families. One of them actually, this new landlord who comes from somewhere, and I think I would share with your audience his method of what exists. The reason they exist is they say that they are simply trying to. Let me just see quickly. Yeah, they are advertising themselves. Their mission and statements is basically to evict people, basically, and so they bought this new building, and people are decent, hardworking. They have been there for some of them 20 years, over 20 years. Some of them were born there, and now they're having kids of their own in this community. And now all he's doing is simply send them N13, which means reneviction. So he wants to say, leave my building, and now I'm gonna just do it, a painting here and there, and then he can also raise the rent. So this is something, it just happened last night, and it's going to continue. We should not allow these greedy landlords who are coming to our community and trying to just bought our community and just simply displace our neighbors and our friends and members of our community. So basically this morning I stood up at the legislature. I made a statement on this to speak about these landlord who's also did similar things in beaches of Toronto on the eastern side, and now they're coming, and I heard he also owns a lot of them, of these smaller mid-sized buildings. So this building is the first one, and I think this is going to be the test. And unfortunately, this current government is simply abandoning communities like ours, rather than interfering and saying no renovictions. So these people, they are not behind rent. They are decent, hardworking. They pay their rent on time. It's only that this landlord who is looking after his shareholders, simply trying to get rid of them, simply because he doesn't want them there. And he wants simply his building to stay in our community, and he wants to raise the rent so they cannot afford it where they live and where they have been living over 20 years. So this is a crisis happening in front of our eyes. And that's why it's very important that we fight back, and that we also make sure that we have a different kind of government, an NDP government that will stop these nonsense and this kind of a discrimination against tenants, because these tenants are not bad tenants. They're good tenants. They're decent, hardworking people. Basically, they're using these what's called renovictions to evict them, and that's not fair. It's wrong.
Aren't there policies that should be stopping this type of greed, especially during COVID and the past year?
Exactly. That's what we want, clarifications. Definitely tomorrow I would be happy to ask the Premier and the Minister of Municipal Affairs and Housing to simply guarantee us or tell us exactly how they're going to help this community. And this is not the first time. It has happened in many communities in the downtown. This company is well known, and I think what they're trying to do is the only reason they exist is simply to evict tenants. That's their own mission, And that's something really opening our eyes when you read their mission statements. And this is not what we want, and we have to stop to this. And I think it's a good argument to say in the middle of the pandemic, we can't just, in fact, he's saying that they only have 3 months to leave. So what he's saying that the law allows me to just give 3 months a notice, and we can just re-evict them, and they have to look for somewhere else. So the community there, those 12 families, they don't want to leave because they don't want. They will not accept that. And I think we need the government to support them and to stop this re-eviction strategy of simply making people homeless.
No, I mean, who can blame them? This is very tragic, to be honest with you, and it's very unfortunate. But we'll please keep us posted, and we'll be following the story very closely. Hold on. If we can continue to speak on the subject of mental health, there are many reasons why people develop mental health. Some are generic, some are biological, some are like results of traumatic experience. In the subject of the Somali community, we have like a history of forced migration that are directly related to the conflict that happened in the 90s. And many of our elderly and especially our parents have suffered through that, and their lives have severely changed. Do you think mental health and especially post-traumatic stress disorder, PTSD, is a big elephant in the room?
Mhm. So mental health, and it's very much tied to determinants of social determinants of health, and trauma, conflict, war zones, or any form of trauma, whether it's war zones, including anti-Black racism and Islamophobia, has a dramatic effect on the mental health of the Somali community and a larger aspect of it, the Black community. There have been studies done actually both on the Holocaust survivors 4 generations after, as well as Black American and the experience with anti-Black racism. And it actually showed that in the DNA, you inherit trauma from your grandfather, your great-grandfather. And so the trauma is actually generational, it's intergenerational, it carries through. So it doesn't surprise me that trauma is also equally inherited in the Somali community because of the civil war, because of the experiences that a lot of our parents and grandparents have gone through because of genocide, because of the military and the way that they treated certain ethnic tribes. So that all of that is really impacting. So when you come to this country and the history of Somali communities and settling into this country is one also equally of policy violence, where the conservative government in the 1990s basically allowed people, they were legally in this country, they were legal and documented and refugees, but then suddenly created a bill, I think it was Bill C-36, which basically made the Somali community undocumented. And that had a tremendous impact on their quality of life because they could not access rent. They can't rent in the open market because no one is going to rent you when they don't know your status if you're going to disappear on them in a week or in a day. And they could not go into higher education. Unemployment was extremely, I think at one time it was about 70% of Somali adults at the time were unemployed. There were people of all educational levels and training, and they could not, all the bridging programs, all the different support, if you compare the support that the Bosnian received and the Serbian received when they came into this country, the support that even Syrian and refugees have received, it was like comparing that, like looking at that historical trajectory. And I think the Bosnian and the Serbian and the Kosovos were the closest people when it came into the Somali community. The Somali and the Afghani and the Tamil community did not get any of that support. It took my mother and many other Somalis 10 years to get their permanent residence and become Canadian citizens. And that was a reality in the Somali community. So poverty is not an accident. Somali people living in community housing is not an accident. Somali young people being susceptible to the criminal justice system, it's not accident. It's very much designed by a very white supremacist system that is making sure that certain population, in this case the Black populations, is economically depraved. They don't have the same access, they don't have the same opportunity. And if we look at mental health, even in terms of access to mental health, Black individuals are more likely to be restrained their freedom taken away in terms of like to be kept within 72 or 48 hours without even any medical justification. And that is some of the statistical data that Black Health Alliance have collected. Black people are less likely to seek mental health support because of the stigma. Because many of them, when they seek mental health support, they don't really get it. There's always a suspect that, oh, maybe you have an addiction issues. There's other issues that comes into forth rather than actually treating the individuals that sought your services as they are, as a patient, rather than racializing or criminalizing them. There's not much of a culturally appropriate mental health services because many cultures, including the Somali culture, they look at, there's a lot of stigma, obvious cultural stigma around mental health, but they also look at mental health as a form of what can we do as a community? What are the alternative forms of community and traditions that we can incorporate, including faith-based? Because if you look at Islamic history, actually the first mental health hospital in human history was built a couple of 100 years ago in Iraq by a Muslim empire, right? By Muslim scientists and doctors. And so we have a very long traditions in our own history of dealing with mental health, but there's a disconnect, that kind of an education and historical nuance within our own tradition. And so in terms of mental health, it's very much complex and nuanced, and mental health is determined by your income. It could be your neighborhood. Violence, gun violence, death of a loved ones has a tremendous impact on your mental well-being. Struggling financially, the sense of taking away somebody's dignity, which is really something that impacted a lot of Somali fathers who are not able to get a decent income to support their families, which also contributed to the breakdown of a lot of Somali families where fathers left the home and the mothers had to handle. There's a study recently released that Black mothers or Black women are more likely to suffer from cardiac arrest or heart disease than compared to Black men, because many times the Somali community are not unique in the Black community. Black women are really the backbone of the Black community, and many of them take on a lot of roles that they shouldn't really take on, but they have to, in spite of it, because they have to deal with their community, they have to deal with their children, and they have to step up in places where a partner doesn't exist, or a Black or Somali father or whomever, and is not there for them.
Faisal, you can, if you would like to add anything to that. Anything
Yes,
to
I think Hodan said very articulately and have explained in more detail, and that is the case. And I think that also I can add that on the Somali community arrived here, it's true that they were not welcome. And this was the liberal policy of John Croce and Paul Martin, and also they even went further, targeting the Afghanis and the Somalis by simply denying them the opportunity to settle here. And it's true that the systemic racism that been, as soon as they arrived here, that have been targeted continues to this day. At schools, lack of opportunities, and this is not just, it didn't happen, it just was designed, and this is also a system where a discrimination is founded and deeply rooted in its structures of governance and systems. But the Somalis, because of that challenges of waiting for 10 years, majority of those people who could not wait for 10 years, they just crossed the border and have settled in the United States and other cities in the South, and they're doing much better than those who that they've left here. But I think it's an opportunity now, the community be uplifted, being also provided specific programs and ways we can help them to give hope and help. And that way we can actually provide more catered programs such as jobs and opportunities, especially young people early on. You know, a lot of young people are now also losing their lives in the streets of Toronto. And that's also something we want to come to an end to it. And I do believe it's a systemic, and that also we want to tackle it in a systemic way and understand why it's happening. It's not just because it's gang related, and when that happens, also how come they're not stopped? How come they're not protected? And that's also another concern of systemic racism that exists, and what we need to do is to provide and also listen to the community. And nobody listens to the community, what they want and what are their needs are. And that's why we had the last 15 years, which was simply not helping the community, but just taking also their votes for granted. It's also the Liberal Party that has simply, have not invested a single project in the community. You can look it for yourself. And since Jonker Chair to the even Trudeau, I don't see even any single program that we can see that's helping this community. And that's why even one community in Ottawa have recently applied a program that the federal government designed, and they said that you are not Black enough. Because they said this was a program, they encouraged a Black community to apply. So I really wrote a letter to that minister, and the minister happens to be a Somali Canadian in that ministry. They said they're going to correct it, but with my letter, they haven't to this day responded to me what the actions were taken were and how they have addressed that issue. I haven't reached the organization yet if they have actually gotten the funding or not. So we have, it doesn't matter who is the minister, you have a system rooted into systemic racism, and you need to change them. To do that, we need strong leadership to tackle these issues, and it shouldn't be happening. An organization that have a track record when they apply government fundings that they've been told you're not Black enough, that's unacceptable. Because Black, to me, it means a couple of things. In a North American definition, to some of us, we see it as a color, and some of us see it as a race. But you see yourself as a Black because of your color, and then you have also multiple identities. And some folks, it's also both. It could be race, it could be color, but still, you can't simply discriminate someone, on that basis. And I think we owe it to the community that the minister be transparent and explains to us that exactly what he has done with regard to that issue.
Hold on. Gun violence is a huge issue in the Somali community, especially even the minority community. How do we tackle this issue, especially since there's a lot of young people and a lot of young boys who are Somalians who are mostly affected by this, also who are incarcerated. So in your experience and with many of the families that you've supported, what is the main issue that, or the roots of the causes of this problem?
So the root cause, it's a complicated one, but how do we handle it? I think it was an epidemiologist who studies viruses or diseases. He's a Chicago medical doctor, surgeon. I can't remember his name, but he actually came up with specific step of how to address when he came back to his hometown in Chicago. And as you know, Chicago is well known for its gun violence. And so when he came back to his community, he wanted to look at gun violence like a virus, which it is, that you do not address gun violence by criminalizing the community and increasing and anyone who's caught with unlicensed gun from 7 to 10 to 20 years. That does nothing, right, for the community, or having multiple police and stations nearby to the neighborhood. It doesn't. That's not really how you are addressing employment for police officers, employment for and prison guards, and building into the prison industrial complex. But you really are not addressing how to eradicate gun violence from the community, how to reduce gun violence from the community. And so his methodology is something that actually has been implemented by different communities in the United States of America and has been successful model, because when you look at something as a virus, you can't arrest the virus, right? When you're looking at an epidemic, something that is spreading in the community. So then you have to tackle the mental health, but you have to tackle also the social network of the community, as well as the income and employment. And a good example is Harris government. I was a kid when Harris government was in power. Ontario, it took them how long? Over 20 years to recover from Harris government eliminating a lot of the youth programs that existed in the city of Toronto. And because what youth programs does, what community programs do, is that it protects young people from being susceptible to street life. Because many young people don't get into street life because they have a decent wages or decent living or safe communities or safe homes. There's a reason that many of them, because I work with clients in my programs and as a career consultant, and many of them will tell me, if I have a livable wage, I will not be on the street. I don't want to be on the street because even though I can make good money temporarily, my quality of life, or the fact that I don't know if I'm going to get shot in the next block, is not something in which that I want to live, right? So many young people are willing to come off street life if they have an alternative to that street life, because ultimately they have to pay rent. Many of them are taking care of families, of kids, whether that's their own biologicals or their siblings. Many of them are taking care of their parent. So there's a lot of tremendous pressures that is on a lot of young people, especially young Black men, to find alternative way of making a living, right? And because the way in which our communities are extremely deprived of any form of investment, if you're not financially investing intentionally, investing in the Black communities in these so-called priority neighborhood or poor neighborhood, then it becomes a cyclical. The system will continue. And again, it's a system that is designed, it's not designed to uplift anyone. It's not designed to create an economic mobility, but it's really designed to keep you down, to create a sense of desperation where you constantly, even when you're applying for grant, you are desperate, you're competing, justify yourself to me, justify your Blackness to me, justify why you should get this grant. So it's more of like a survival of the fittest mentality, the way in which that we are dealing with our communities and funding allocation. A good example that I will hope Faisal can look into it as an MPP is that the provincial government gave 24 hours notice of eliminating justice programs that houses young people, youth who are in conflict with the law. They gave 24 hours. So what it meant is that in Northern Ontario, Indigenous kids and Black kids were suddenly taken out of their home, put in an airplane without any notification to their parents, and their parents found out afterward where they're going to be housed, somewhere so far away from their home. You know, things like that. If you really care about gun violence, other than creating militarized police so they can continue to harass and arrest and criminalize young Black youth, the way that you go about your priority. So all they wanted to do is eliminate, save $25 million, but that $25 million could have been utilized differently into address gun violence, into address community need and young people, so they don't have to be intergenerationally in the system, in the criminal justice system, continue to be there until adulthood, all the way even that their children will end up in the system. Because guess what? If you are in conflict with the law, the likelihood of your child becoming in conflict with the law is extremely high. Many people who are being incarcerated, their children will be incarcerated. If you've ever come across Children Air Society, you are more likely to be incarcerated. You are more likely as a Black youth to end up in the street life and into sex trade, specifically for young Black women. So there's so many other elements that kind of build onto each other, because people just look at the gun violence, that kind of a immediate violence, but what are the consequences of gun violence? Why do they exist? Another issue is the easy, cheap access. Like I remember when I was growing up, it was hella expensive to get a gun, but now it's extremely cheap. So it's saturated into the market. No one is dealing with how do they end up, who is benefiting, because it's not Black communities who is benefiting, who is at the border that are letting these guns in, who is letting these guns into the community. There's not much of an actual supervisory investigation to look at the source. It's like drugs. How do drugs get into communities? No one looks at that. They only look about who's using the drugs and how can we arrest them and incarcerate them.
Felix, so feel free to add anything into that.
Well, I think that's Hodan articulated very clearly here, and I think that is very important. We have to look at it, the root causes of these issues, and there are multiple issues. Yes, the guns are not made in here; they come somewhere else, and they are probably a network or networks of organized that are bringing in and providing young people to these gangs. And I think the approach of treating violence, gun violence as a virus also does a couple of things. You don't just simply put an entire community into prisons, but also to intervene early on. And I think one of the things we are understanding now is that the systemic racism also pushes people into when individuals are denied for jobs and opportunities, and they have to feed their families. You know, they will do all sorts of things to help their community. But I think what we need to do is to provide those programs that Hodan just talked about, income support, those opportunities of social networks, youth programs, community programs, and also early on interventions. For example, I'm the youth opportunities critic for the official opposition, and we realize that young people, no one listens to them. You know, no one actually brings them into a forum or a space to ask them, what do you need? What is your issues? And I know that the high school students, for example, have created MPP Hassan's Youth Council. These are students from high school, and some of them are first year university. And this is their first opportunity to even understand what the provincial government, they even, haven't had enough study in school to see the functions of the government and their representatives. But if we bring early on opportunities of summer jobs, opportunities of other opportunities for them. For example, when the school is closed, we have these community schools. We can use them as a community hub. We have good recreational places where they could play basketball, soccer, and that is also not allowed for the community, the coaches who are doing it for free, to help them support them. We have also in Toronto community recreational centers where the programs that are designed, registering it is also very difficult. Also, anyone can access it. You can come from anywhere, PGC Stew, you can come from anywhere, and some people are coming to our community. For example, York Recreational Center here, which is a brand new facility, but the programs we want, the community also be reserved at least percentages of those programs. So the community, we don't want others who are part of the city to denied to come to our community. We get that. Sometimes they can offer programs here, but we want also the community, which didn't have a lot of facilities, to also have certain percentages of those programs, say 30%, 40%, and then the rest of the city residents can access to that. So there is no focus of communities like ours to have those facilities, but when they have them, then they're encouraging other community networks to use those facilities, not the people who live here. So there's also another issue of class and also lack of also encouragement to talk to them and say, what kind of programs do you want in the community centers, in these community hubs? But this requires also the community also mobilizing it and having a voice, having representatives, saying also not just being told who to vote, but also getting involved and knowing also who's on their side on these issues. And that's, I think, is very important, and not just waiting for them. And also when these students, as you know, the University of Toronto, which is a prestigious school, I was told 98% of the students there come from private schools. So there's only 2% that are coming from public schools. So
that's my alumni.
Yeah, majority of our community they are only that 2%. And now these opportunities, when they are preparing for those, and also in the Black community, 100%, a percentage is only 18 goes to post higher education. So we need to change that. And also we have to also see and work with union folks like Hodan and say, how can we also improve performances? It's not against evaluation. It's not against anything. How come some schools are doing well and schools, people who look like me are not doing that well. What's wrong? And how do we make it and standard where we could have every schools should be working like those schools who are working well? So we need to focus and have discussions, not just challenging the teachers, but also working with them and saying it. How come those teachers in those schools are doing very well, but not the ones over here? And how do we improve that? Talking to the parents, talking to the teachers. And that way, I think we could be able to have a different kind of result. Also think about school and work also go hand in hand. So we have to also prepare young people early on what kind of work they are dreaming, what kind of a profession do they want early on. And where they are in universities and colleges, we can also provide them internships and placements and co-ops that are not just doing for free, but that are paid positions. And last year, February 28, I put a motion at the legislature with regard to work integrated learning, so that we create more spaces, not only the provincial government, but also every municipalities and every private sectors, so that we could provide every student who are enrolled in university and colleges internships, placements, and co-ops. So we also think of also work and school go hand in hand. And there's also barriers for also access to higher education, Ahmed. So also we make it also these schools that are also accessible to everybody who wants to study. That means we have to look at how the question of tuition. We have to look at also grants, so that we should not be worried about a cost of going to school, but that the government can look after that, and you could focus working and studying, so that the young people then feel there are opportunities out there for me, and they will be also tracked. They want a little bit of money, then there's also that opportunity early on in high schools and also in colleges and universities, and they'll be motivated. We can also create programs where we could say also every young person in high school, in first year in university can go back and also help their communities. They have positions also kind of that they could be paid to do that every year. And that way also young people could also get early on in leadership and providing that opportunities. And those also who are unemployed and not in school, then we can also provide them opportunities of skill trades, where we can actually pay them to study in skill trades. So that way they could also have skills, and say after a couple of years, they will be able actually to earn every week more than 4,000, or more, because of the skill. And that's also well-paying jobs. So if we can also encourage those young people who are unemployed to bring them into the community, bring them everywhere they are, and put them to track, make sure we pay them to get those cooperatives and skill trades, then we'll be able to have a workforce who are able to actually have skills. And when we provide them early on also in high schools, also some skills there also, not only the academic, but also other skills we can teach them in there, and every student should be also focused on academics, not only streaming too. So that way we will also have every young person ready to go to higher education, either engineering or whatever field of study. But if we are based on discrimination or systemic racism that exists, I can remember when I entered the University of Winnipeg, my professor, Introduction to Business, the first question he asked me was, why are you here? No one who looks like you succeeds here. Brilliant, now that might not happen, but this is the kind of systemic barriers and racism that is enshrined in institutions of higher education. It's not actually giving an opportunity to young people, but they are, gatekeeping, putting barriers, and trying to make sure that a lot of young people fail. We need to change that, and I think a lot of things have changed, but we can do better.
There are two things that you said that I agree with. One being that I think we should find a way to utilize our schools, especially in the summertime, to do programs such as you said, whether it's co-op or athletics. So you can have even free programs, such as even someone like myself who plays a lot of sports, soccer and basketball, and I can even coach sports such as those, and I can even utilize my time if I wanted to in the summertime, provide opportunities for young people. It's very hard for us to find the utilities and the programs or places to do that we that isn't free, for example. So to find ways to that we can utilize these buildings in place times that is closed and running programs is a really good idea. And also, I've always said it's not who do you vote for, is what you vote for,
Exactly.
and explaining what are you voting for is more important than the person that is voting. And you should always look at a person based on his report card, not just what he says. And I can see that you're a strong advocate for a lot of policies that promote inclusion and that support diversity, and hopefully we can see successfully in the next few years. Hodan, how could people reach you, and
My
is there
picture will pop
anything
up.
you're currently working on?
Yeah, so something that I actually wanted to mention is that we are in the 10th decade for the UN decade for people of African descent. And the Canadian government is exceptional in this case as a settler land, that they actually acknowledge the decade and promise to live up to the promises of the decade, which is recognition, development, and justice. And so I am a UN fellow, and for the 2020 and for the UN Human Rights Commission office, they created this program, and actually this program is funded by Russia of all places. And Russia is the only one who donated fundings for the decade of people of African descent. And Canada and all, the United States didn't even acknowledge the decade. England, finally, London, a friend of mine, Iffy, who was the fellow with me, convinced the London mayors and the assembly to recognize the decade in London, but they're building on into the UK. And so that is something that I'm actually working on. My fellow Canadian, and all of them are Somalis, and we ended up uniquely the only 3 Somali women in this UN fellow representing Canada, beside 2 other Black fellows from Quebec, Montreal. And so what we are working on is really for the federal government. We try to connect with the Black parliamentarian, but they haven't really responded yet, to not just recognize the decade, but actually have tangible, actionable policies and legislations around the decade, because the decade is supposed to be addressing where the government lacks, and around justice when it comes to policing issues, around development, which is economic investment into the Black community. And we're also working on, we're trying to push for, and with other allies, to recognize Black Canadian as a distinct category, because that makes a tremendous difference at the federal level, because visible minority no longer really address Black issues. Black Canadian, Black issues are very distinct issues that is not the same as Indo-Pakistani issues or other issues. And we don't want to be lumped together, because our history, or the history of Black people in this continent, is as old as a transatlantic slave trade and beyond, right? And so we wanted to, the same way that we have Indigenous identity as a distinct identity and woman as a distinct identity, it means that policies and fundings become allocated from the start, from the get-go, to those issues. And so we're trying to campaign and work on having Black people as a distinct category, and to have something similar to the PAC and the unit that exists at the municipal level, to have, because there's an anti-racism directory at the federal level, to actually have a unit that is exclusively focusing on anti-Black racism. But we'll see what happens.
Well, that's great. I think we will support that as the official opposition on that.
For sure. I'll reach out to you guys.
Yes, and if you guys want to meet with us, Hodan, you could actually reach me, send me an email, fhan@ndp.on.ca, and then I'll be happy to facilitate that. And I think we would like to have that discussion and also incorporate into our upcoming platform as well. Already we have committed to actually making sure that, you know, our commitment on Secretariat of Anti-Racism is actually, we have created also a critic for that, to working now on that issues as well. So it's very important to make sure that, you know, we address the issues of racism.
Faisal, and what are you currently working on? Because I know you passed the bill 178 for Black, for African Canadian mental health.
Yes, I think that's one of my bills, Bill 175. I've
Sorry, 175.
debated recently. Housing is as a human right, and a bill which was very important in my community and across the province, which was also co-sponsored with my colleague from Brampton Centre. And this bill was a bill to actually do couple of things. One is to create a working group to study the inequities and disparities with respect to housing that exist. And there have been a study that the Toronto Social Planning have put recently released a report of 5-year study, and two professors, Professor Lou Ann Gingrich and I think Naomi Lightman, have been leading this study. This study was actually talked about the housing inequities and disparities that affect people because of their blackness and also income and other variables as well. And so you would have created a working group to study how it affects people on inequities and disparities, and also to create a housing commissioner that will report to the Ministry of Housing and municipalities. And their sole purpose is to collect data of evictions, the issues of inequities and disparities in housing as it relates to. And this would have been acknowledging also and recognizing housing as human right. Unfortunately, this government also voted down quickly as we debated. So, and this government have been voting down every single propositions we put forward, but they don't even understand. I mean, having a working group to actually look into and have also experts and people with lived experiences, appointed by the minister to actually study these, how it affects communities across the province. It actually would have brought some recommendations, some good collection of data, and also having that independent commissioner appointed to collect those data as related to inequities and disparity would have enhanced the issue of housing as a human right. So that's one of the, and also I'm working also, as I mentioned, the paid sick days. If you are sick, stay home. It's very important. 60% of workers don't have paid sick days. And the argument all the time, this government is saying it, oh, the federal government has it. But this is our responsibility as a provincial jurisdiction to have that. And we owe it to our workers, especially the frontline workers who cannot take one single sick day off. It doesn't make sense. And it is proven that when workers have that, in many jurisdictions, when they are sick and if they stay home, that actually helps the other workers continue their productivity. And it also gives a morale the worker that they're not worried about. If they are sick, they can stay home. And that also encourages the workers to actually work harder, and they are motivated to produce even more because now you built a relationship with the employer. And that's what we are trying to do to also make it also economic sense, also in the middle of a pandemic, also to make sure that we also look after the frontline workers. So they also, what did this government do? They voted down again. And that's unfortunate. We have seen also the PSWs who are frontline workers. They are really doing a fantastic job. But we want them to also raise their salary for extra $4 to give them a living wage. And what does this government do? They acknowledge them. They say they are heroes. They say they are our heroes, frontline workers. But their actions doesn't respond to that. They don't support that in meaningful way. What do? They vote down again. So there are many issues that we're working on to make sure also my community right now, we are in the middle of vaccinations facilities. What this government did? They downloaded all these Toronto Public Health to the job of vaccination roll out and also facilities. The Toronto Star reported they have put about 350 locations throughout the city of Toronto. There is no one single location in my community. Think about that. How do we address these inequities? You know, we have also large seniors over 80 years of age who need to have their vaccinations. So this is also, I've asked the Minister of Housing and the Premier why this is happening. She says that they're going to address this, but I'm working with them to make sure that this community is not left behind, so that we have, I also provided more suggestions. So we have more locations that the seniors, especially they can go to their homes, they can go to their apartments and help them that way, rather than putting them, in a massive risk to a huge facility, asking them to go to Metro Toronto Convention or Scarborough, places like that. It is Toronto, but it is far away from our community. We want to have access places like that in our own community.
Not only elderly, you also have frontline workers. So yeah, so the vaccination, so that's very important. And how can you be best contacted?
Or you can contact me. My office is located 1965 Weston Road in Mainstream there. And the phone number is 416-243-7984. And you can also email me, fhassan-co@ndp.on.ca. And that's also through the office, and I'll be able to respond to you promptly. Also, my handle, I'm also accessible on Twitter and also Facebook on my page and my Instagram. And my handle is Faisal Hassan MPP, on Twitter, on Instagram, and also my page. Also, every Saturday, Ahmed, I also, as a transparency purposes, I also have Bring Your Coffee and Tea every Saturday from 3 to 4, so we can talk about your issues. So every Saturday, people can join me, my Facebook page, to have discussion if they have questions, or if they have comments as well, to tell me something about it. If they cannot wait to leave a message or call or write, they can contact me directly, and also join me live on Facebook page, Faisal Hassan NDP, every Saturday from 3 to 4.
Faisal and Hodan, I would like to thank you for your time. But not only that, thank you for your advocacy, your hard work, your support, and your commitment to not only minority communities, but also to the Somali community. I look forward to speaking to you again, and thank you for your time.
Thank you so much, Ahmed.
Thank you.